develops paralysis due to the snake venom. One of these snakes is called krait. It's called krait, K-R-A-I-T, krait. In the venom of the snake krait, a toxin is present in the venom of the snake krait, or toxin is present which is called alpha bengarotoxin. Alpha bengarotoxin. Alpha bengarotoxin is present in the venom of the snake krait. And this alpha bengarotoxin is a competitive blocker of neuromuscular transmission. It is a competitive blocker of neuromuscular transmission, and it causes the muscle paralysis in the victims of the snake. So it causes muscle paralysis in the victim of the snake bite. It causes paralysis, fallout, right, in these victims of the snake bite, right? So this was about the neuromuscular transmission blockers, right? Now, in addition, there are certain drugs which stimulate the neuromuscular transmission. These drugs include methacholine, colbicol, nicotine. Methacholine, colbicol, and nicotine. Now, these drugs resemble acetylcholine to bind with the acetylcholine receptors. So these drugs bind with acetylcholine receptors, and their action resembles that of the acetylcholine. These drugs produce depolarization. And keep in mind, this depolarization is prolonged. Depolarization for minutes to hours. So these drugs produce prolonged depolarization lasting for minutes to hours. And this ultimately results into muscle relaxation. But to start with, there is muscle spasm. But ultimately, these drugs result into muscle relaxation. So why these drugs cause prolonged depolarization? The reason is these drugs are not removed from acetylcholine receptors because these are not hydrolyzed by the enzyme acetylcholine esterase. So these drugs are not hydrolyzed, not destroyed by the enzyme acetylcholine esterase. Acetylcholine esterase not removed by the enzyme acetylcholine esterase. So these persistently remain bound with the acetylcholine receptors, resulting into prolonged, persistent depolarization. But then there are certain drugs which are anti-choline esterase. These are anti-choline esterase. That these inactivate the enzyme acetylcholine esterase. And these anti-choline esterase drugs, these include neostigmine, physostigmine, and diisopropyl fluorophosphate. So I am telling you about the anti-choline esterases the drugs which inactivate the enzyme acetylcholine esterase, and these include the neostigmine, physostigmine, and diisopropyl fluorophosphate. Diisopropyl fluorophosphate. So as there is inactivation of the enzyme acetylcholine esterase, acetylcholine is not destroyed. And when you give this drug, it results into more action of the acetylcholine. There is persistent depolarization, right? It results into muscle spasm. Now this diisopropyl fluorophosphate is very poisonous. It is a nerve gas. And when some is exposed to this nerve gas, it results into spasm of the larynx. And death occurs when there is spasm of the larynx. So this diisopropyl fluorophosphate is also called nerve gas. It is poisonous. In person who are exposed to this nerve gas, there is a spasm of the larynx, and this results into death of the individual who are exposed to diisopropyl fluorophosphate. Right? So this was about the drugs which are anticholine esterases. Next we start just introduction to the muscle. We have completed the nerve and neuromuscular transmission, and now we will discuss about the muscle. You know, muscle is of three types. So three types of muscle: skeletal muscle, cardiac muscle, and smooth muscle. So skeletal, cardiac, and smooth muscle. Skeletal muscle, it forms about 40% of the whole body. Skeletal muscle constitute 40% of the body. And other 5 to 10% is the cardiac and smooth muscle. Another 5-10% is the cardiac and smooth muscle. It means that muscle, it forms about 50% of the total body. So muscle forms about 50% of the total body. Now discuss skeletal muscle in detail. Skeletal muscle is voluntary. It consists of individual muscle fibers. Each muscle fiber is a muscle cell. In skeletal muscle, each muscle fiber is a muscle cell. Muscle fiber extends throughout the length of the muscle. It extends throughout the length of the muscle. Skeletal muscle fiber has a diameter of 10 to 80 micrometer. So 10 to 80 micrometer is diameter of the skeletal muscle fiber, and length is between few millimeter to many centimeters. So keep in mind, the length is variable. Few millimeter to many centimeter is the length of the skeletal muscle fiber. Skeletal muscle fiber has got many nuclei. It is multinucleated. And nuclei are at the periphery. It is multinucleated and nuclei are at the periphery. The membrane of the skeletal muscle fiber is called sarcolemma. So sarcolemma is the membrane of the skeletal muscle fiber. Its cytoplasm is called sarcoplasm. So sarcoplasm is the cytoplasm of the skeletal muscle fiber. In the sarcoplasm, of course, I have mentioned it is multinucleated, have multiple nuclei, which are at the periphery. So nuclei are multiple, and these are at the periphery of the muscle fiber. So nuclei are multiple, and these are at the peripheral part of the muscle fiber. In the sarcoplasm, there are the cell organelle, mitochondria, Golgi apparatus, right? And also the endoplasmic reticulum. We call the endoplasmic reticulum as sarcoplasmic reticulum. It is sarcoplasmic reticulum. It is also called the sarcotubular system. The sarcoplasmic reticulum is functionally very important in the muscle. The sarcoplasmic reticulum is very important in the muscle. I discussed the sarcoplasmic reticulum in detail. Sarcoplasmic reticulum consists of two types of tubules. So two types of tubules constitute the sarcoplasmic reticulum. Longitudinal tubule or L tubule. Longitudinal tubule or L tubule. So these longitudinal tubules or L tubule have dilated ends, which are called terminal cisternae. This is the longitudinal tubule, and this is dilated end, which is called terminal cisternae. Terminal cisternae of longitudinal tubule surround T tubule or transverse tubule, right? T tubules extend from one side of the muscle fiber to the other. So these extend from one side of the muscle fiber to the other. This is the T tubule, right? So I told you that there are two tubules which constitute the sarcoplasmic reticulum, L tubule or longitudinal tubule. The other is T tubule or transverse tubule. The longitudinal tubule has got the dilated ends, which are called terminal cisternae. Terminal cisternae surround the T tubule, which extend from one side of the muscle fiber to the other. T tubules communicate with the extracellular space, and these contain extracellular fluid. So T tubules communicate with the extracellular fluid, and T tubules contain the extracellular fluid. These contain the extracellular fluid. Now, if we give a section to the sarcoplasmic reticulum, if we cut a section to the sarcoplasmic reticulum, it gives an experience of a triad. So if we cut a section to this muscle fiber, to sarcoplasmic reticulum, it gives appearance of a triad. A triad. And this triad consists of this is a triad, the longitudinal tubule, L tubule, this is the T tubule, its cut section, and again this is the longitudinal tubule, L tubule. So this gives the appearance of triad. Now this triad junction of the terminus cisternae along with the T tubule is present in skeletal muscle at junction of A and I band. A and I band. A and I band. So junction of the A and I band, this triad is present. So this triad is present in the skeletal muscle at the junction of the A and I band. Sarcoplasmic reticulum, I mentioned, is functionally very important. And it is involved in the storage, release, and uptake of calcium ions. So very important is functionally the sarcoplasmic reticulum. Involved in the storage, release, and uptake of calcium ions. So again repeat, involved in the storage, release, and uptake of calcium ions in the muscle. So this was about the sarcoplasmic reticulum in the skeletal muscle. So we'll continue inshallah tomorrow. Thank you.